Welcome back to complete our discussion talking about temperament in children. Joining me again is Dr. Robert Hudson, Clinical Professor of Pediatrics at the University of Oklahoma School of Community Medicine. Let's jump in. Now, I want to pick up on this ADD, ADHD concept because that's a big one for kids in schools and diagnoses. How should we really look at that? You mentioned at the end of the segment of how we can manage the environment or different things that we can do.
Improve the fit.
Yeah, improve the fit. So what kinds of things should we do? I mean, is telling a child who's really fidgety and just all over the place to sit still, is that a good thing?
Right. Well, that's a good question, and I think that there's a book called Temperament in the Classroom that has studied this, and I've been in a lot of different classrooms, and sometimes the teachers are very aware, and sometimes they're not. And I've done workshops. I asked the teacher, well, what happens when the children start fidgeting? And almost all the teachers say, we tell them to stop fidgeting.
Right.
And instead, they should look at that as a barometer of these children have been still in their seats about as long as they can. It's now time to do something active. And it may be 3 children. And so you get them up and maybe have them dust the blackboard or run an errand or just walk around the class or something to sort of take the edge off that. Sometimes our expectation that a child that's 6 can sit longer than they actually can. Now, then we say the child that's inactive, who can sit still for 4 hours, they're good kids.
Right.
Well, it doesn't have anything to do with good or bad. It has to do with what your energy level is.
Okay, and when we look at this diagnosis of attention deficit disorder, is this really a behavioral issue? We want to classify it as just a behavior problem.
That's a very good question, and it's a misconception. ADHD really is not a behavioral issue. It has to do with how active they are, how persistent they are, and how distractible they are. So those are all learning things. They can, of course, have the behavioral drivers, which is adaptability, and if they're really having behavioral issues, it usually is the adaptability. And in a classroom situation, the teacher may know what's going to happen at 11, but if she doesn't tell the class until 2 minutes until 11, oh, put your pencils up, we're going outside, about a third of the class that's less flexible is going to start and say, oh, and they're surprised. And these kids don't do well with surprise. They need to know what's going to happen in the future, so the more you can tell a child what's going to happen in the future, the more relaxed they can be.
I think too we can look at that as adults in some of the adult temperament styles.
Absolutely.
Because in meetings, I know for me, if they tend to be more than an hour and they're not really action-packed, I begin to doodle, do other things, or you have to get up and take a break because you're trying to sit there, but you just really can't because there's nothing that's keeping your focus anymore.
That's true.
And so it's the same kind of thing. And then we hear people a lot of times will say, well, people keep telling me things at the last minute.
Yes.
And they expect me to drop everything and do it.
Right.
Well, the child feels the same way. It's that type of temperament style if that's what you have.
Right.
So we can kind of reflect back on what we do or we see others as adults and see why that can be normal with children too. It's the temperament.
If you look at it from the child's point of view, their brain is right here. And if a parent walks up and says, I want you to do this right now, you've just jerked his brain over here, and these children don't transition fast.
Right.
Their brain is just not programmed. They have a slower process speed. So a better way to approach it from parents and from teachers is to say, I expect you to do this within the next, or we will be doing this within the next 10 minutes, or give them some warning that there's going to be a change so they can transition. 7% of the population is ADD or ADHD. Close to 30% are inflexible.
Okay.
But yet we don't, and that's the major driver of behavior and gets us stressed as adults if we're less adaptive. Your boss comes in and says, I want to do this right now.
Right.
I can't do now.
Right. How can I transition?
Or I don't do surprises well.
Exactly. Now let me ask in our last few minutes here, shift to this concept, which still is the temperament issue of the gifted child. Because that's a big one where we have programs for the gifted.
Right.
Tell me a little bit about this concept of gifted children.
Well, a new study out that says that maybe we're putting a little bit too much stock in the testing of 4 and 5-year-olds. In fact, the study looked at them at 10, and only 40% of kids that were gifted at 4 and and 5 were still gifted at 10. So that's the same thing. This is what's normal, and the rate you get to here at 10 varies.
Okay.
So if you're gifted at 10, you're gifted. If you're gifted at 4 or 5, you may or may not be gifted long term.
Interesting.
And so we put a whole lot of pressure on kids and all, and then when they start falling out of the gifted at 6 and at 7, you know, everybody's really upset. But these are the children that developed early. The kids that become gifted at 6 or 7 and missed all this extra attention just matured a little bit later.
So in dealing with children then, because sometimes we will talk about, like say, that very young child, well, you know, they're already reading and they're 3.
Right.
They're already doing this and they're this. Should we just sort of look at what is just the norm that they're accomplishing and not necessarily, like you're saying, put it out to this is a miraculous kind of thing?
Right. And I think that if a child wants to read, to help him learn to read, and if he reads early, fine and dandy, that's great. But to put too much stock in it, I think is, you know, this is the next Einstein kind of thing, puts a lot of pressure on the child. And when we start praising them for they're so smart, it intimidates and overwhelms them sometimes. And rather we should be praising effort. You know, you must be proud of yourself because you worked hard, rather than I'm so proud of you because you got an A.
Exactly.
And I'm so proud of you because you got an A is really manipulating the child and putting a whole lot of pressure on them to say, you must be proud because you worked hard for that. You're giving them all the credit, and that's where the credit should be.
Okay, now let me ask this question. We talked about retaining children because of this temperament style, and that's really not a good thing to do.
Right.
What about them jumping ahead because of temperament style? Is that a good thing?
Most of the research says it's really good to keep them with their peer group. If they're really ahead of the class, then give them extra things to do rather than jump them ahead. Because socially, there are very few kids that are advanced in every area. And so then you put them in a social situation and in a peer group that they're not used to. And that's really puts a lot of stress on the child that's really not necessary. So the smart classroom teacher knows this is the smart child, I'll just give them extra work. So while the others are doing this, here's you some extra work to do. And I think that works very well.
Okay, I like that concept. As we begin to wrap up, what do you want people to remember about this concept of temperament in children?
Children are different. As my granddaughter says, duh, pawpaw. But children are different, but sometimes we have the way we treat children as one size fits all, and it doesn't. Okay. And the reason parents have trouble and struggle is that they're trying to do calculus when they've only been trained to do simple math. Not so easy child, a child that has a difficult temperament, really needs, the parents need extra help to learn to manage them.
Thank you so much,
You're
Dr.
welcome.
Bob.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also, don't forget to visit me on YouTube at youtube.com/Health Alert USA. And remember, praise the effort and not always the grade. Take care. This program would not be possible without the support of OU physicians in Tulsa.